I would like to explain the K-electromoxa treatment method for patients with lower back pain, a condition that is commonly seen in clinical practice. When treating lower back pain with acupuncture, we usually focus on the acupoints located along the first line of the bladder meridian. However, when using the kelectromoxa, we primarily select the hua, tua, jia, ji points, which are located closer to the spine than the acupoints of the first line of the bladder meridian. In clinical experience, applying the kelectromoxa to the hua, tua, jia, ji points often produces better therapeutic effects than treating along the bladder meridian's first line. For the procedure, the treatment points are located at the 3rd, 4th, and 5th lumbar vertebrae, L3, L4, and L5. Starting from the 5th lumbar vertebra and moving upward, place the kelectromoxa terminals on the hua, tua, jia, ji points, which are found 1.5 centimeters lateral to the midline, governor vessel, on each side of the spine. Attach 3 terminals on each side for a total of 6 kelectromoxa devices. When fixing the terminals, it is recommended to apply the medical tape diagonally, considering the placement of the next terminal. If the clinic is busy or if you want to save time during preparation, the acupuncturist can mark the Moxibustion points in advance using a surgical marker, and a nurse or assistant can attach the K-electromoxa terminals to those marked points with medical tape. Afterward, the acupuncturist can simply set the treatment temperature and the number of sessions and begin the procedure immediately, which helps greatly reduce the preparation time for K-electromoxa treatment. Since the lower back area is relatively less sensitive to heat stimulation, it is recommended to use one of the higher temperature settings, 47 degrees Celsius or 49 degrees Celsius, and to select 5 or 7 sessions for each treatment. For the first treatment with K-electromoxa on a lower back pain patient, it is best to start at a relatively lower temperature of 47 degrees Celsius. Then, as the treatment is repeated and the patient becomes more accustomed to the heat, you may gradually increase the temperature to 49 degrees Celsius to enhance the therapeutic effect. That concludes the explanation of the K-electromoxa treatment method for lower back pain. Thank you for watching.